For joining me on my presentation of Cytology 101 at the Square. My name is Sharice Fleming, and I am the Cytology Supervisor. So, cytology, by definition, is the study of cells, where we look at abnormalities and we can look at different organisms or bugs for interpretation. Our department at Franklin consists of a cytoprep technician who processes all samples submitted to the cytology department and assists with preparing slides for fine needle aspirations, also known as FNA. Our cytologist or cytotechnologist performs microscopic evaluation of patient samples to diagnose cancer, precancerous lesions, benign tumors, infectious agents, and inflammatory processes. Specimen processing workflow is that Franklin Square Cytology processes and primarily screens all cytology specimens for the Baltimore region. That includes Franklin Square, Harbor Hospital, Good Samaritan, and Union Memorial. Initially, we receive our specimens, which can have potential for FNA slide prep assistance, which will entail one of our techs, either our cytoprep technician at Franklin or one of the cytologists, or at the other facilities that can be a lab assistant who assists with preparation of those slides, performed either by a radiologist or endocrinologist. Once we receive those specimens, our initial specimen processing step is to gross and accession all of our cases, where we will get our case numbers. The cytologist will then examine the cases under the microscope and provide primary interpretation. Once that interpretation is complete, it goes to the pathologist for review and they provide the final diagnosis. For our preferred containers for our cytology requests and specimen categories, we have our CSF that has an empty container without any fixative in that specimen. We have our body fluid specimens that can include pleural, peritoneal, pelvic washings. That also contains no fixative. For the respiratory and urinary specimens, we use sterile containers, and that can either be a container or a sterile trap. Those containers do not contain fixative. The preferred fixative that we use for brushings and fine needle aspirations is the Cytolite, which we will use to prepare our thin prep slides. These are the only specimens that are collected for cytology that have fixative for collection. All specimens must have a completed cytology requisition. And since we are a Baltimore region facility, we have the different locations here at the top. We have to have the hospital patient label. The AP label is where we would add our label after accessioning, and all the asterisks are required fields that we would need completed. And everything that's on the requisition needs to match what's on the specimen container that was submitted. For fine needle aspirate assistance, I have a demo video of how we prepare those slides. If we had multiple nodules, like a left upper pole and a right upper pole, we would do 3 passes for each nodule, and they would be A and B. Once we take those slides back to the lab, when we're done with the procedure, we make sure all of the labeling criteria is met for everything and everything matches. And during processing, we make a diff quick smear. That's the purple. And then we have a pap stain smear that looks blue. And those are only prepared for our FNA specimens. And sometimes we'll get brushings that have smears as well. Outside cytology processing and equipment, we have our cytocentrifuge that we use to prepare our cytospins, which could be a diff quick and a pap stain. And then we also do a cytopap stain for CSFs. The diff quick stains are used to assess for cross-contamination for extremely cellular specimens or worrisome for malignancy. And that CSF cytospin we get from hematology. They run that on their Sysmex processor, and we usually get that slide after they're already done with their evaluation. Our multifuge centrifuge is used to prepare our specimens that are, and they are divided to make a thin prep slide and a cell block preparation. Our thin prep processor is used to prepare those thin prep slides. After centrifugation, supernatant is poured off into a waste container and the pellet is added to the thin prep preservative solution for a special stain. And if requested, we can also perform for a pap stain. And if requested, we can also provide special stains. All thin prep slides are made for cytology specimens except for the CSF. For our cytology processing, we have two different color cassettes for our specimens. We have medical cytology cell blocks, which are orange, and then we have the FNA cytology cell block, which are lilac. And then you have our H&E cell block slide that's stained in histology. So cell blocks are prepared in cytology, but the cassettes are submerged in formalin and then taken to histology for processing, embedding, cutting, and staining. Special stain requests ordered on the cytology requisition will have a thin prep slide in addition to the cell block, if applicable, which is prepared by cytology and stained in histology. Here we have our Gemini stainer, which is an automated stainer, and we also have the stain line that we use on this automated stainer. Everything's pre-programmed, so you don't have to worry about anything. You put it on and let it run until completion. We also have an automated film cover slipper that we use in histology that allows us to be able to get our slides out sooner because the slides are usually dry and you don't have to worry about glass cover slipping and any excess mounting media. After processing, staining, and cover slipping, cytology screening is performed by microscopy. And our Cytology 101 piece. So Dr. George Papanicolaou is the father of cytopathology. His initial research on guinea pigs showed that histologic changes in the reproductive tract are also detectable in vaginal secretions when viewed under the microscope. In 1920, due to not being credentialed in the US, Mary, who was his wife, was his initial sole test subject, which soon began to include female friends. He was eventually granted access to patient samples from Cornell University Medical College's gynecology clinic. With having a larger sample population, he realized he was able to distinguish non-malignant or normal cells from malignant cancer cells, which meant that cells collected from the reproductive tract could be used to diagnose cervical cancer and other related diseases. While there were setbacks, by 1943, the published findings provided guidance on how to properly collect PET test specimens and how to interpret the results. By the 2000s, implementation of the PET test had cervical rates down by nearly 90%. The two broad classifications of cytology include gynecologic or GYN, which is our pap test, and non-gynecologic, non-GYN, that includes medicals and FNAs. Cytology classifications by collection type. We have our exfoliative, spontaneous shedding of cells. swabs or shed cells in the fluid collected from various body cavities, which includes your pap test, body cavity fluids, urines, and CSF. You have abrasive, which is scraping, washing, or brushing of the targeted area. That will include your respiratory, esophageal, bile duct, and etc. Alimentary specimens. We have aspirations where it's a mass or lesion sample that's collected with a small gauge needle, and that can include thyroid, breast, lung, and any other accessible organs. The normal cancer cell structure, for your normal cells, you'll see large cytoplasm, a single nucleus, a single nucleolus with fine chromatin. With your cancer cells, you're going to see small cytoplasm, multiple nuclei, multiple and large nucleoli, and coarse chromatin. So the coarser chromatin has a darker color. You're going to see more of the clumping, and you see more of the abnormal structure of the cytoplasm. The normal cells are more round. Normal versus cancer squamous cells. So here we have your normal squamous cells, and then you have a histologic section showing squamous cells. Then you have your squamous cells here, which is for cancer, and also a histologic section there. Normal versus cancer glandular cells. Here we have your normal benign looking glandular cells. They all look tall, they're lining up. Then you have your cilia here, then you see a terminal bar. That lets you know that it's normal or benign. And there's a histologic section of benign glandular cells. And here is cancer cells of glandular cells. You have more vacuoles in your structure. You see they kind of look clumped together, loss of polarity. They're all going in different directions. And then you have your sections here for histologic sections. And we also can interpret organisms and bugs. Here we have HSV, herpes simplex virus on cytology, and then your histologic section. Then here we have spores and budding yeast, and that's our Canada on cyto, and then the histologic section. Now that we've reviewed some normal versus cancer cells, can you decide which one is which? What type of cells do you think this is, normal or cancer? If you guessed normal squamous cells, you are correct. What do you think about these cells? Normal or cancer? If you guessed normal glandular epithelial cells, you are correct. What do you think about these? Are they normal? Are they cancer? Are they bugs or organisms? And here we have different special stains. You have your GMS, you have AFB, and you have your PAP stain. If you guessed organisms or bugs, you are correct. What about these? Oh, cancer cancer squamous cell carcinoma. What about these? Are they normal? Are they cancerous? Cancer cells, adenocarcinoma. If you got all of those correct, applaud yourselves. If you see anything that looks familiar, continue to learn and engage. If you see anything that was new to you, take note and just see how cytology and histology work together, and enjoy the rest of your session. Here are my references, and thank you for your time.